We're at the IAS meeting in Paris. We're here with Christian, who is from Canada.
Yes.
And you're with the Positive
Canadian
Positive Network. People's
Network.
Okay.
Yes.
People Network. It's really a great honor to have somebody from Canada, because we generally, we had some people that came, but I guess everybody's growing up.
Yes.
You're a younger person. I am excited to see that you're enthused about the work that you're doing, because that is important for people to take. The new blood has to take over the reins of the work that has to be done, and to see people like yourself and others that are here is important for me, and as well as the young investigators and all the others that are receiving awards for doing the work that they're doing. So tell us about the Canadian Positive People Network.
Great. Thanks, Fred. So the Canadian Positive People Network is an independent network formed by people living with HIV in Canada. So within the context of HIV activist movement, I think within the Canadian context is a little different from many other different countries, in that we, all through this time, since the beginning of the epidemic, we haven't had a national independent network formed by people living with HIV. And we're quite new. I'm one of the co-founders and one of the current co-chairs. We've been existing for about 2 years, really voluntary based and run for now, and hopefully we can procure some funding so we can actually do and implement more of what we are hoping to achieve for people living with HIV.
So describe what you actually do at this point, because you're new, so it may evolve. It likely will evolve.
Yes. So this year we are engaging in a strategic planning process. Right now we are, finalizing a community-wide e-consultation. We currently have about 130 members across the country, but Canada is a pretty large country. We have about 74,000 Canadians living with HIV. To help us to ensure that the priorities that we engage in is accurate and represented the diversity of people living in HIV in Canada, we just really want to ensure that we have a good assessment of what the needs are.
So do you segment people so that they feel more comfortable? I don't know. You and I'm older, you're younger, but you have women, you have black people, you have other people from other countries, people that speak other languages.
Yes.
You have 2 languages.
Yes,
sure.
English and French, and Canada is very diverse. And at this conference, IAS 2017, it's great that there's the Paris Community Declaration that really speaks about the rights of key affected populations, right? So for Canada, what our network is trying to do is really ensure that there's that equity inclusion as well. So aside from the mainstream organization, we need to ensure that we speak to the rights of perhaps youth, women, racialized communities, including aging populations for sure. Yes, and indigenous peoples. When we define key populations, Canada has a specific list, but then we also want to ensure that there's flexibility there as well, right? We recognize that sometimes communities may be hidden. So how can we actually, serve as wide a community as possible? That's what we're trying to do and figure out.
So you're in the planning stages at this point.
Yes.
But very valuable. Now, how will you communicate? Do you think through the new Facebook or all of the above, all of the social?
Yeah, so far, because we don't have a lot of funding, we have mostly communicated with our members through Facebook, or Twitter, and then electronically. But then once we do get funding, and hopefully we do, then we're planning to have an in-person capacity building symposium. So
that'll bring everybody to one central place.
Yes, and really engage in more of a face-to-face type of planning.
Do you have any? In the United States we have the conferences that go on. Do you attend those? Is there something you do in Canada that's similar? Have a national conference?
Right, the Canadian landscape there has there's a number of national partners. The Canadian AIDS Society has been hosting a PL-HIV forum for a number of years. Their mandate is mainly to represent the needs of various AIDS service organizations. So, how we come into the picture is really want to ensure the voices of people living with HIV is at the forefront.
Right. Many times the establishment takes over and you don't have the real, like we were just saying earlier, nothing about us without us.
Yes, exactly.
Yeah, so, and I really appreciate that because it's essential. We often find that to be the case, that people who are empowered but not positive come in and it's different.
Yes,
and not that there's anything wrong with those folks pitching in, but it is important to have those that are living with the disease actually speaking on their own behalf.
Absolutely.
So, do you work also with development of drugs and so forth? Is that something you might want to do? Think about?
That is not our primary focus, but in terms of more patient-centered advocacy, in Canada there's the Canadian Treatment Action Council (CTAC) that is doing a lot of forefront of that work. But for us in our role, I'm sure as we evolve and as our members or the community inform what our priorities would be, we would engage in those types of advocacy as well. Yes, for sure.
Because it may be that somebody's like a nurse or somebody like that, and they're very educated in science. So that would be their opportunity to step in and say, okay, I want to be a community advocate.
For sure.
We are also, I'm involved with an organization called AIDS Treatment Activist Coalition.
Amazing.
And that would be something that we'd like to talk with you about.
Yes, for sure.
We are always looking for new advocacy. And I know that they have a European meeting with a lot of pharma, but when we have the meetings in the United States, often we've had people from Canada come in. So it might be a natural consideration.
Well, in Canada, the drug regulatory system is very complicated. It's complex. Right now, in terms of, let's say, hepatitis C drugs, right? With such high success rates of a cure, not all the people living with hepatitis C or co-infection are benefiting from the treatments, and why is that, right? So I think in terms of how people on the ground living with various health conditions have the right to say, we need to have access to treatment. For Canada, as a high-income country, we are very lucky to have access to treatment. But yet, sometimes there are specific populations which are more marginalized. Let's say, newcomers who may not have status, and if they come as refugees, and sometimes they may not be able to see doctors, may not be able to immediately get treatment, or indigenous communities. So
you have to have some provision for those folks.
Yes, and I think in the end, we all want equitable treatment and access for everyone. So yeah. And
that kind of brings us into the U equals U. It's really a focus of mine.
Right.
Because I've said this for years. I mean, you could go on Craigslist and you'll find, I want to find somebody that's negative. Okay. When in fact that may be the most likely person that's transmitting the disease. Because they may know in their mind that they're negative, but it's very easy that they could have been infected between the last test and now. But the person who's positive is treatment as prevention. Treatment is prevention. So being treated and being undetectable brings you to the point where we've done the studies, the partner study. We don't have anybody that's broken through there. And these are people all over the country that are still believing that they are the only way they can be safe is to have unprotected sex with somebody who is negative.
It's true.
So they think. So what the organization that you're showing on your T-shirt there is very empowered to really get to the people who need to know this. Even doctors, I mean, doctors.
For sure, and policymakers, and government, states, donors. This campaign U equals U is a campaign that started by Prevention Access campaign. I, as a person living with HIV, an activist, am involved with the campaign, and the Canadian Positive People Network has also signed on to support the consensus statement, the U equals U consensus statement. I think this campaign has been a very organic movement that has really mobilized communities and people living with HIV worldwide to ensure that this knowledge is disseminated to people living with HIV, to hopefully the public as well. You know, it's really changing the discourse of HIV. Aside from the benefits of positive prevention, treatment as prevention, is really talking about health literacy. You know, for us to understand how HIV works within our system, why having treatment is beneficial. How can we ensure that people living with HIV stay on treatment? Why is adherence important?
It's an important component to that.
Right, and then in terms of access to medications, there's a lot of inequities, global north, global south. Why is there still a lack of treatment for people living with HIV? I think Michelle Sidibe said, for the first time we have more than 50% of people living with HIV on treatment. That's great to celebrate that. Yet also, why is there the remaining percentage of people not getting access to treatment? And how can we actually formulate the right kind of advocacy tools and demands to ensure pharmaceutical companies and governments can ensure universal health and treatment access for all?
Yeah. And that's a wonderful and powerful statement. I really appreciate your energy. Mm-hmm. You seem to have just what we're looking for.
Okay.
No, we all of us are living with AIDS. But it is important to have you out there doing the work. And I hope that we'll meet again.
Yes,
I
thank you.
hope there'll be an opportunity for us to do more.
Okay.
And connection. This is all about networking.
Yes, for sure.
You're a giant network to begin with, but networking more is even more important. We will talk.
Thank you, Fred.
We'll talk. Thank you.
Pleasure. Take care.